Do you or someone that you care about struggle with drugs, alcohol, or any other addiction? You are not alone. I'm Gretchen Johnson, and I'm an addiction medicine physician at Community Fairbanks Recovery Center. According to recent data, of people 12 years and older, 13% reported using a non-prescribed controlled substance in the past month, and 24% had at least one episode of binge drinking of alcohol, which is defined as 5 or more drinks for men and 4 or more drinks for women on one occasion. Benzodiazepines are used by 12% of the US population. These statistics may seem grim, but the good news is there is hope. Let's take a step back and define addiction. The American Society of Addiction Medicine defines addiction as a treatable chronic medical disease involving complex interactions among brain circuits, genetics, the environment, and an individual's life experiences. People with addiction use substances or engage in behaviors that become compulsive and often continue despite harmful consequences. Prevention efforts and treatment approaches for addiction are generally as successful as those for other chronic diseases. That's right, conditions like high blood pressure and diabetes are treatable, and addiction is treatable too. Let's talk about medicine. Seeking professional medical help immediately is recommended if you think that you have a problem with drugs or alcohol. Millions of Americans struggle with this, but millions have found hope and healing. In order to stop using substances as safely and comfortably as possible, certain medications may be used in either a hospital or clinic setting. There are medications available to help with cravings and to reduce chance of overdose. Let's talk about going beyond medicine. There are many welcoming communities of fellow humans in recovery who are creating beautiful, positive connections and are staying sober together. There are hundreds of meetings, known as AA, NA, HA, CA, or nearly any other A that you can think of, meeting daily in our own city. In addition to these, there are more faith-based groups such as Celebrate Recovery, spirituality-based groups such as Recovery Dharma, science-based groups such as Smart Recovery. Many of these groups have online virtual options if you can't get there in person. There are many great apps such as the Meeting Guide app that can be easily downloaded onto any phone to give you real-time data on which meetings are close to your present location. There's also formal therapy, which is often offered in a group setting but can also be individual. You may hear terms such as counselor, life coach, therapist, intensive outpatient, partial hospitalization program. These are all resources that help us think about the reasons why we use substances. Again, you are not alone. Struggling with compulsive overconsumption is something that every single person can relate to, and we all have reasons. Pains of the past, stresses of the present, worries about the future. But the good news is that brains heal and recovery is possible.